guys, I wish you good health. In this video, we'll talk about greater pectoralis, which being affected by trigger points can give reflected pain to the clavicle area, shoulder joint, arm, and front of the chest, imitating pain in the heart area, as well as contribute to development of cardiac arrhythmia, stagnant processes in the mammary gland, and indirectly affect the appearance of pain in the interscapular area. We'll take a look at the exercises you can use to make yourself feel better at home, as well as helpful tips for preventing pain. I'm Sergey Chernov, doctor, yoga master. Let's go! The anatomy of greater pectoralis muscle is quite complex, but it's important to know it in order to accurately detect problem areas and find therapeutic exercises. In short, the muscle consists of 4 separate parts: clavicular, sternum, rib, and abdominal muscles. Medially, the greater pectoralis is attached by the clavicular fibers to the clavicle, by the sternum fibers to the sternum, by the rib fibers to the cartilage of the 2nd to 6/7 ribs, and by the abdominal fibers to the superficial aponeurosis of the external oblique abdominal muscle. Laterally, the large pectoral muscle is attached in 2 layers to the crest of the large tubercle of the humerus. Working in all parts, the greater pectoralis performs horizontal shoulder adduction, internal rotation of the shoulder, shoulder adduction, and also participates in the chest movement during breathing, being a part of the additional respiratory muscles. In addition, the clavicular part of the greater pectoralis is involved in shoulder flexion, and the sternum, rib, and abdominal muscles are involved in the shoulder extension from a position where the shoulder is bent at the shoulder joint and the arm is raised up. When the humerus is fixed, the greater pectoralis muscle is able to move the sternum and rib attachments toward the humerus. By performing tension of the rib cage, it participates in forced exhalation. The greater pectoralis also helps to hold the weight of the body during push-ups on the uneven bars. Myofascial trigger points of the greater pectoralis muscle can be located in 5 areas. Trigger points localized in the clavicular part of the greater pectoral muscle cause pain over the front part of the deltoid muscle, and locally in the clavicular part of the muscle itself. Trigger points located in the sternal bundle closer to the middle reflect intense pain to the front of the chest, and can imitate the heart pain if the left greater pectoralis is affected. Pain may also spread down the inner surface of the hand, along the palmar surface of the forearm, and along the ulnar surface of the hand, extending to the ring and little fingers, or the ring finger and the half of the little finger. Trigger points of the great pectoralis can also cause a feeling of tightness in the chest, which can be mistaken for a manifestation of angina. However, you shouldn't write off any pain in the body to the presence of trigger points, and the first thing to do when having the described pain symptoms is to exclude angina and myocardial infarction as quickly as possible by doing an ECG and other necessary laboratory tests. And only after cardiac pathology has been ruled out, it makes sense to look for the problem of muscle pain. It's worth mentioning that damage of the heart muscle in myocardial infarction can trigger viscerosomatic process which causes activation of trigger points of the middle area of large and small pectoral muscles. After recovery from an acute myocardial infarction, these trigger points may remain for an extended period of time until they are eliminated. Trigger points in the sternal muscle closer to the chest cause local pain and over the sternum. If they are located on the left side, this pain can also be confused with heart pain. The intensity of the pain may increase with arm movement and also disturb sleep. Myofascial trigger points are found in the rib and abdominal bundle of the greater pectoralis major muscle in 2 areas. Triggers located near the lateral edge of the muscle cause breast tenderness with oversensitivity of the nipple when touched and chest pain. Such symptoms apply to both women and men. The nipple can become so sensitive that it makes it difficult to wear a bra or short. When this bundle of muscles is affected, there may also be a feeling of overflow in the mammary gland. When comparing the glands, one of them may be slightly enlarged in size and have a doughy consistency, which may indicate a violation of the lymphatic outflow caused by muscle compression, which is eliminated after inactivation of the trigger points. If a person has a cardiac arrhythmia, keep in mind that a trigger point associated with somatic visceral cardiac arrhythmia may be found on the right side of the body between the 5th and 6th ribs. It doesn't cause pain, but it can affect the heart rhythm. There may also be other painful points near it that are not related to cardiac arrhythmia. The greater pectoralis affected by the trigger points is in a shortened state and provokes prolonged overloading of the scapular adductor muscles, including the middle part of the trapezius and rhomboid muscles. which can result in back pain and protruding, pulled-aside shoulder blades. A shortened clavicular part of the greater pectoralis muscle can shift the clavicle down and forward, which can lead to excessive tension of the clavicular head of the sternocleidomastoid muscle and development of head pain and various vegetative phenomena. A shortened clavicular part of the greater pectoralis muscle, in addition to the above-described pain symptoms, can also limit the arm movement in the shoulder joint, especially horizontally. The most common reason for the occurrence and long-term existence of trigger points in the large pectoral muscle is an incorrect posture. For example, excessive kyphosis in the chest area, rounded shoulders, and forward position of the head. This refers to prolonged incorrect body posture while sitting in front of a computer. Physical activity when doing sports can also provoke overloading of the greater pectoralis muscle and cause distinctive pain. This can happen at the gym when doing a bench press in horizontal position, or when performing an arm reduction on a butterfly simulator. Prolonged muscle overload can also occur in the reduction position, when cutting shrubs with large garden shears, or when the upper limbs are in a fixed elevated position for a long time, when using a high-powered saw. Fractured arm and prolonged immobilization in a plaster bandage, hypothermia of overworked muscles under air conditioning or in a draft, and emotional overstress can also cause the development of specific pain. Individual work at home aimed at eliminating of trigger points in the greater pectoralis consists in applying a strong mechanical impact on the trigger area followed by stretching the affected bundles of the muscle. At first, take a big massage roll and if you're a male, roll the whole front part of the chest, preparing the muscles and fascia for more intensive work with a small massage ball. You can make rolling movements back and forth, as well as left and right, from the chest to the side surface of the ribcage. Take a 3-inch massage ball and get to the wall. You can work on the painful areas of the greater pectoralis muscle in this position, but be careful with the working surface. The wallpaper or paint on the wall can be damaged by regular use of the ball. To avoid damaging the wall, you can use a special support block, which has a protruding outer edge that prevents the ball from slipping out. Detect areas of tenderness by using the trigger point map described above, and apply strong mechanical pressure to them for 1–2 minutes. Women are strictly forbidden to roll mammary glands, but you can gently work out the upper part of the greater pectoralis muscle on it. These same muscle areas can be easily worked with a small massage ball. To get wide access to the lower parts of the greater pectoralis, lie on your back and stimulate the areas of tenderness with a massage ball, controlled with the help of a support block. Obviously, if a woman has pain in the chest area, the first step will be complete diagnosis of the mammary glands, excluding a variety of abnormalities including a tumor, and only after the medical examination it's allowed to work on the muscles. After mechanical impact on the trigger points, be sure to stretch the muscle and the surrounding fascia, since the main function of all the bundles of the greater pectoralis muscle is the horizontal adduction of the shoulder. They can be stretched by horizontal abduction of the shoulder. The simplest exercise to stretch both pecs at once is the following. Step into the doorway. Stand firmly with one leg back. Look in front of you and hold your head without pulling your neck forward. Spread your arms apart and press them against the wall or door jambs. Lower your elbows below the shoulder joints to extend the clavicular area of the greater pectoralis muscle. To stretch the chest area of the greater pectoralis, get into a position where your elbows are at the same level as your shoulder joints. To stretch the rib and abdominal areas of the muscle, raise your arms higher so that your elbows are above the line of the shoulder joints. Push your body forward and keep calm and deep breathing, trying to increase the degree of stretching with every third or fourth exhalation. Hold the final position for 30 seconds to 2 minutes. It's better to go through all 3 positions at one time to ensure that all parts of the greater pectoralis are stretched. If you practice my yoga workouts, you've probably noticed that they include such exercises as Dhanurasana, Purvattanasana in various modifications, Astrasana, Camel Pose, Urdhva Dhanurasana, Bridge Pose, and several other exercises in which you stretch your greater pectoralis. If you don't practice yoga according to my complexes, that's a shame. I'd recommend starting on your own with the simple Yoga for Beginners playlist. It contains short complexes for 20–25 minutes that will help you gradually get into regular practice. After you're done with the greater pectoralis, it makes sense to work the antagonist muscles that have the opposite function. The middle middle part of the trapezius and rhomboid muscles, as they are contracted by the greater pectoralis and the triggers can be activated there. How to work with these muscles on your own I showed in detail in the playlist that deals with myofascial pain syndrome and trigger point. The most important requirement for getting rid of trigger points in the greater pectoralis and the pain they cause is to correct the posture, rounded shoulders, and eliminate the forward position of the head. When sitting in front of a computer, women with large breasts can suffer not only from compression of soft tissues by bra straps at the shoulder joints and excessive kyphosis in the chest area, but also from compression of the ribcage, which provokes activation of trigger points in the greater pectoralis. In this case, it's necessary to expand the bra or wear a larger sized one. It's very important to avoid prolonged temming of the greater pectoralis while sleeping with your arms crossed over your chest. The pillow shouldn't be just placed under the shoulder joint. Its angle should be placed between the head and the shoulder. If the greater pectoralis is affected on one side of the body only, it makes sense to use an additional pillow while sleeping on the healthy side, on which the forearm should be placed, thus preventing the arm from hanging down and the muscle from shortening for a long time. When sleeping on the affected side, you should use a pillow placed on the armpit between the arm and the chest to support the extension of the greater pectoralis. Thank you for your likes and subscriptions. Also check out the video about the supraspinatus muscle, which can cause pain in the shoulder and arm. I wish you good health and wonderful well-being.